Good morning, everyone. As a part of FOGSI Infertility Committee Endometriosis Awareness Month, that is March, with the key campaign that is the Endometriosis Doesn't Wait. So this is a small initiative for the better outcome and treatment for the endometriosis. So endometriosis is a clinical diagnostic and a clinical radiological entity which needs a complete radiological evaluation for its better treatment. So let's begin with the approach to the endometriosis case. Let's start with the approach to the case of endometriosis. Coming to the radiological anatomy of the endometriosis, the entire MRI pelvis of the sagittal section is being classically divided into three basic compartments of evaluation of deep endometriosis. That's the anterior, middle, and the posterior compartment. The anterior compartment comprises of the vesical space, that's the comprising of the bladder, and its surrounding the pre-vesical space, that's actually called as a space of Ridges, or the post-pubic space. And it also consists of the ureter and the vesico-uterine fold, which is actually marked as red. And it consists of the vesico-vaginal septum. And the middle compartment usually comprises of the endometrium and the parametrium and the myometrium, with comprising of the which is uterine serosal surface, which is also acts as a deposits for the deep endometriosis. And the most common site for the deep endometriosis, and which is usually classically missed, is usually the torus uterinus, which acts as an insertional site for the uterosacral ligaments. That's actually outlined in the purple color. And the posterior compartment usually comprises of the bowel, that's the rectum, and the sigmoid, with the rectovaginal septum, which is described in the pink color. And another most space which is classically missed is again the retrocervical space, which acts as a deposition for the plaques of the endometriotic deposits. And the next important thing is the types of endometriosis. There are three classical types described. The first is the ovarian type of endometriosis, which is usually forms as the endometrioma, which we usually classically call it as a chocolate cyst. And the second second part is the superficial type of endometriosis, which is usually cannot be picked up by the most sophisticated MRI or the classical ultrasound imaging systems. This is usually being missed with no imaging techniques to be diagnosed. Usually this relies on the clinical setup. And the next important imaging and the most common type, which is usually being in the radiological workup, is the type of the deep endometriosis. And the deep endometriosis is usually classically defined previously as any endometriotic deposits which includes greater than 5 mm extending from the peritoneal serosal surface. And as per the consensus guidelines of 2021, it is usually now the guideline of greater than 5 mm is being removed, and any serotic endometriotic deposits penetrating the peritoneum is classically called as a deep endometriotic deposit. Now, coming to the type of first, the ovarian involvement in the endometriosis. The classic or the tip, always the endometrioma shows the classic pattern, that's the showing the ground glass pattern. This is usually classically defined as the GG pattern, that's the homogeneous ground glass pattern, which showing sequential or the low-lying, or it's also called as a low-lying internal echoes. And as described in this figure, usually majority of the endometriomas actually comprises of only one cyst, and majority it can actually go up till greater than or equal to 3 in each of the septum. And some of these septum usually shows very less internal vascularity, not so predominant like that of the hemorrhagic cyst. And these chocolate cysts can also undergo a hemorrhagic transformation, showing some of the hemorrhagic components, giving a very less internal vascularity. And as we can see in this figure, the peripheral, they are very, very tiny punctate echogenic foci outside or surrounding the chocolate cyst. These three are the common descriptors for the classic description for the endometriosis, for the endometrioma. And coming to the MRI evaluation for the endometrioma. First, usually the MRI usually includes T1, T2, T1 fat sat images for the classic evaluation of the endometriosis. Here in this figure, we are able to see, this is the T2 image showing another classic descriptor for the endometrioma is T2 shading. The T2 shading usually occurs because whenever the chocolate cyst undergoes a hemorrhagic transformation with hemorrhage, that usually shows as T2 shading. And this is the another T1 fat sat image showing suppression of all the surrounding fat sat images, excluding the internal endometrioma. And in this image, this is the sagittal section of the MRI pelvis showing hemorrhage. That's the T1 MRI showing a hyperechogenic content. That's the hemorrhage. So whenever any image showing a T1 hyper in the cyst, that shows the hemorrhagic component. Here we can see it even more. And another one, actually every endometrioma is very well capsulated. So we can even identify the capsule on the MRI section. And in the T2 image, the MRI, the capsule, the black capsule that shows a hypointense rim. The capsule is actually hypointense because of the deposition of the hemosiderin. And the most important is where do we actually have to evaluate the endometriosis? That's the deep endometriosis. Actually, as well, very well said, we have to search for the sites of the deep endometriosis. So the first one, as actually previously described, that's the ovary. We'll search for any kind of endometrioma there. And the second one, as previously said, the most common site is the torus uterinus, the common insertional site for uterosacral ligaments. And the third one is the bowel, or where to find is the rectum. And the fourth one is the bladder. These all forms the primary sites for the evaluation of the deep endometriosis. First, coming to the anterior compartment. Let's divide the endometriosis into anterior, middle and deep compartment, or the posterior compartment. The anterior compartment endometriosis, in this image, we are able to see a very T2 hypointense lesion involving the anterior or the upper superior wall of the bladder. And there is involvement of the bladder wall surface. So here we can actually see even the detrusor muscle. There is loss of the detrusor muscle hypointensity. That shows the endometriotic deposits are showing smooth muscle proliferation with the involvement of the bladder wall. And very commonly asked is the entity called as the kissing ovaries. Where do we actually find the kissing ovaries in every case of deep endometriosis? The answer is actually no, because the kissing ovaries are actually a form or a form of endometriosis which is with the underlying pathologies of the adhesions. Here in this MRI image, we can find this is one ovary, this is another ovary. Due to very high adhesions, both the ovaries come closer into the anteriormost or the center, forming the entity called as the kissing ovaries. Mm. The posterior compartment endometriosis. Here in this image, this is the bladder, this is the sagittal section, this is the uterus, and this is the bowel. These are the outlines. Here we can see that there is loss of the outline involving the uterine serosal surface and the bowel. So this forms the bowel endometriosis. Here in this image, we can see there is loss of irregularity between the uterus and the anterior surface of the bowel, showing irregularity. And in this image, we can even see that the bladder is with the detrusor muscle is also being involved. Yeah, the next entity is the torus uterinus. This forms the most important for the diagnostic workup. Here we can see the torus uterinus is actually at the intersection between the uterine and the cervix part. So that's that you can find at the cervical uterine junction. So this is the outline for the bladder, and this is the outline for the cervix. These two outlines are being intersected by a mass. That's the endometriotic deposit. And some of the common signs what we are generally asked forms a better and the best marker or the soft markers for the deep endometriosis. The first is the Mohs antler sign. The Mohs antler sign is commonly found in the bowel endometriosis. This is the ultrasound image. This is the ovary, and the hyperechogenic material here is the bowel serosal surface or the outer layer of the bowel. Here we can see that the outer layer of the bowel and the uterus is actually forming a deposit or the irregular hypoechogenic lesion is found there. That's taking the shape of the Mohs antler. That's classically described as the Mohs antler sign. Another most common sign which we actually found in every or majority of the cases of the TVS is the question mark sign. The question mark sign is actually occurs whenever the upper part of the POD usually gets involved with the adhesions. So whenever the upper part of the POD gets involved, there is a slight pull or intense pull of the upper part of the fundus towards the POD. That's forming the classic question mark sign. Now, these are all the images, or that's how we diagnose the endometriosis. Whereas there is one classic thing that we actually do in every part of the endometriosis is the classic augmented pelvic ultrasound. This is usually the routine pelvic or TVS examination that we actually do with one or two most important sites we undergo with the best evaluation. This involves the 4 steps. The step 1 is actually which we actually do with the evaluation of the uterus and the underlying adnexa. But the step 2 includes the evaluation of the soft markers such as the ovarian mobility. We actually even find is the ovary mobile or not, because if the ovarian mobility is compromised, that usually finds there are adhesions. And the step 3 for the status of the POD. If any POD is involved, and by that we can actually find a true sign, that's the sliding sign. This sliding sign involves whenever we do a TVS examination, put the probe in the posterior part of the cervical vaginal fornix, and then just put a hand on the upper part of the abdomen, and then whenever you push the probe inside, there should be a mobility of the posterior part of the bladder and the anterior part of the bowel. That usually presents as a positive sliding sign, that is normal. In every case, we find there is normal sliding sign. Whenever in the same examination, whenever we find that the bowel or any of the vesicle serosa is not mobile and is being adhered, that shows a positive sliding sign, that shows a negative sliding sign. So that forms a case of the endometriosis. And by this, this forms as a soft marker for the evaluation of the endometriosis. And for the step 4, we assess the deep endometriotic nodules in the anterior and the posterior compartments respectively. To approach endometriosis scientifically, please call to this below a number for the free consultation.